Now, when a child has a nosebleed, the amount of blood that can come out of the nose can be quite significant. But if there's a history of bleeding disorders like hemophilia or von Willebrand disease, any of these bleeding disorders, children, when they get nosebleeds, they can bleed a lot.
So today on Pediatrics to Go, let's talk about nose bleeding. What causes it exactly? How can you diagnose nosebleed? Everything about nosebleed with Dr. Sanusi. So here's a cue.
Hi, thank you for staying with us and for watching us. We're going to talk about nosebleeds, and we do have a lot of children that have nosebleeds for one reason or the other. Now, the reason a lot of children have nosebleeds is because we have end arteries in the nose. So most times I draw a nose and I have the end arteries like this. So these are arteries that just end abruptly, and they're covered with a lining, which is quite thin. When children have dry mucous membranes in the nose, especially during the winter time in America where there's a heater on, the skin can crack that's covering these end arteries. And then you have the arteries. Remember, arteries are under pressure and they're pulsated. So when children have nosebleeds, that's arterial blood. So the bleeding tends to be bright red. And sometimes when children have a cold, they blow the nose so much that it can remove the lining of the nose that's covering the arteries, and then they get nosebleeds. So if a child has a cold, they are more at risk to have nosebleeds. And some children, when there's dry air, they tend to have nosebleeds. And some other children just have spontaneous nosebleeds just because the end arteries are quite superficial in the nose. And if they pick their nose and they pick it a bit too much, they can remove or basically they can break the lining that's covering the arteries, and then they get nosebleeds. Now, when a child has a nosebleed, the amount of blood that can come out of the nose can be quite significant. But if there's a history of bleeding disorders like hemophilia or von Willebrand disease, any of these bleeding disorders, children, when they get nosebleeds, they can bleed a lot. If they start bleeding a lot, what we recommend, just have a child sit down. That decreases the blood pressure of the arteries in the nose, and have them bend forward and put their hands on their nose. I tell parents to hold. No, you don't want to look up. You want to bend forward, put the hand on the nose and close the nose. What it does, the end arteries are like this. You basically squish or suppress, you close them, and that stops the bleeding. I usually recommend to hold the nose for at least 5 to 10 minutes just to decrease the risk for the bleeding to continue. And then you want to just kind of pinch it with a firm pressure. Once you do that and you stop the bleeding, most doctors would recommend putting a humidifier in the room to put moisture in the air. You could also do plain old Vaseline to the nose. Just use a Q-tip and put Vaseline in the nose. That helps to protect the lining of the arteries in the nose to prevent nosebleeds. The other thing you can do is, if it's something that happens all the time, then you need to have your child see ENT. And sometimes the ENT, which are the ear, nose, and throat surgeons, they'll actually go into the nose and cauterize the artery that keeps bleeding or burn it so that it doesn't keep happening over and over and over again. Some people might use antibiotics because I've seen children who have strep end up with nosebleeds just because strep can be in the nose and it can cause impetigo. Impetigo is a bacteria that lives in the nose, and sometimes when children have the infection in the nose, you do antibiotics and that takes care of the nosebleed, or the bacteria can weaken the lining of the artery and cause children to have more nosebleeds. So when you do Bactroban, which is an antibiotic that you put in the nose, that kills the bacteria that's in the nose, causing the nosebleed, and you can take care of nosebleeds like that. So generally, when children have nosebleeds, depending on the cause of the nosebleeds, you want to treat. But if you want to prevent nosebleeds, especially if it's from dry mucous membranes, just do Vaseline on a daily basis, once or twice a day. And apart from the humidifier, treat with antibiotics if needed. But if you do all that and the nosebleeds goes away, then everybody's happy.
And if it doesn't?
Then you see ENT, and then they'll cauterize or burn the arteries. But and then if it's something that persists where it's so much, then the child needs to be checked for bleeding disorders like factor 8 or factor 9 deficiency and von Willebrand disease, which are all bleeding disorders in childhood.
Wow.
Yeah.
Bleeding disorder.
Yes. Yeah. Because nosebleeds can be an indication that there's a abnormality in the blood. So the blood might not be clotting well, or you might just be lacking clotting factors, which is a factor 8 or factor 9 in the clotting factors. If you're deficient in any of those, then you can have nosebleeds that just don't go away. And that's genetic. You get it by autosomal recessive spread. So that if that gene runs in the family, there's a 25% risk for each child to get it that you have.
So how would they deal with it knowing it's a genetic factor?
You just know that it's a genetic factor, and you avoid situations where you can bleed. And then there's you're followed by hematology, and then they make sure that if there's anything going on, especially if you have nosebleeds that are severe, and they might want to give you other treatment like undercar. There's all kinds of treatment that they use for children who have those bleeding disorders. So to prevent nosebleeds from happening, they'll take care of you and make sure that you get the care that you need.
But also, like, when children... Okay, no. I was going to ask something else, sorry. I was thinking about, like, children when they play with sharp objects and they cut themselves too.
Well...
Yeah, that's just it.
Yeah, it's all the same. It's all the same. If there's excessive bleeding, then you want to go to the emergency room. And in rare cases, you might need blood transfusions. But that's if there's bleeding disorder. If you don't have bleeding disorders, it doesn't get to that. It's not that severe.
Okay.
Yeah.
So that means it's not like a serious issue when you have nosebleeds.
If you don't have a bleeding disorder and it's just a tiny nosebleed, it's not a big deal. But you don't want it to keep happening because it can be uncomfortable for the child.
And losing blood is not even a good sign.
No, you don't need to. If you don't have to, why? There's no need for that.
Okay. All right. Thank you. Okay, bye.